Blessings, everybody. We are here today with a phenomenal woman. I don't know, words just escape me. As weer eens onze besigheid, our business, and we are going to dig into the lives of Henrietta van Kramberg. A woman that I admire, a woman that just stands out for me on so many levels since I've met her. She's gone through life issues, which you will obviously hear now, and die vrou is net vir jou baie. Just amazing. I can't even find proper verbs or
vocabulary
to describe. And I know I always tell you she's blessed.
Yes.
True. And so first of all, Cancer Awareness World, how did you say it?
Cancer World Day.
World Day on the 4th of February.
Yes.
So tell us what's happening. Tell us what's on your heart.
Worldwide, there's an awareness that's created around cancer, all kinds of cancers.
Okay.
It's usually just an opportunity for people to come out and talk about cancer, whatever cancer they have, for people to get information about cancer. People are always encouraged to be aware, knowledgeable, so that knowledge is always power.
Of course.
So worldwide there'll be, just the buzz will be around cancer. And in South Africa, a lot of campaigns. Usually the shave-a-thons happen around that time for people to donate their time, their money towards cancer research, which is so important.
Yeah.
So it's going to be a lovely day, as always. Some of us are just chilled about it, but whatever little we can do to bring awareness, we do.
And to contribute, of course.
Yes.
So would you say you are like a walking cancer dictionary?
No, I'm not.
When it comes to awareness, I mean, knowing you obviously equipped
for the awareness.
So when I was newly diagnosed, I was the face of campaigns around cancer because we wanted, with the organizations I was working at the time, we wanted to bring awareness that Black people also do get cancer. But then when you talk about the knowledge, the extensive knowledge, you'll hear when I speak about my journey. We knew nothing about cancer as a family. We knew nothing about cancer. We had to quickly get up to date.
So nobody in your family has been diagnosed?
So they were not diagnosed. My mom had cervical cancer, I think 3 or 4 years just before I was diagnosed. But routine. You go for your pap smear. She's in her 50s at the time, or late 50s, I think. And so they pick up cancer cells and then they do a hysterectomy, which is very common, but it's cancer.
Yeah.
Yes.
So, and so people don't really say that. But whenever you go to a doctor and they say, any history of cancer, we all just tick no. But there's those small things.
If you think about it, like, I think with me it was the same thing. My ovary was removed because of fluids, and when they picked up, it was cancerous. So they had to remove. And now when you say that we tick that box to say no cancer, it's like something new to me because that's what I did. I never ever ticked that it was cancerous before or there was a sign of cancer.
And even afterwards now, you have to unfortunately acknowledge that cancer cells were in your body. But I'll tell you as we speak why we need to be knowledgeable, acknowledge cancer. So I had to quickly get up to scratch.
And I mean, knowing you like facts. I know you liked you, and you had to equip yourself so that you can either be at ease and understand what it is that's happening to your body, and then at the same time explaining your family. Because as much as you have that fear or uncertainty or whatever you're going through,
imagine the
family
members
also.
And then, but when it comes to the knowledge of cancer, I don't think you will ever get up to standard.
Yes, it's
because
constantly
every year
changing.
there's new stuff coming. There's new different cancers that they discover.
Yes.
So
and
wow.
treatments are always evolving.
Yeah.
Yes.
Good thing. Thank God for science.
Thing,
eh?
Thank God for
and
science.
I think what we as the humans lacked was, remember years ago there was this cancer can be beaten thing
Yes.
where you can conquer cancer.
Yes.
And I don't think a lot of people, because na kyk jy toe is dit nie weer 'n storie wat hulle sommer oor praat nie. Dis dit meer jou HIV and you know stuff like that. En mense begine nie praat oor cancer nie, because if you have to look at the death rate of people dying with cancer, it's so high. And it's because people weren't making a fuss about cancer like they did previously. Because for me, ek het geleer van cancer by die skool, because it was made known to us that there's cancer. Cancer so can be beaten. It was like a matter of you can
like they had that
this
campaign at that time where
and I don't think they've got those anymore.
They don't. No. That's what I'm saying.
Please don't say that.
Because now it's a matter of people die because of a lack of information. And a lot of people do not want to acknowledge, and other people just don't feel the need to learn. When you were talking about the pap smear thing, I would always encourage women to go for pap smears.
Yeah, she does.
Because I think it's a good thing. I go because I'm not sick, but I go because I don't want to find out too late there is something wrong, or I have certain issues, whereby if I can stop it beforehand.
100%.
And that started happening when they removed my ovary. So I said I need to go I go every year. They said you can go every second year, but I make it my means to go every year. And if we can just bring the awareness back, I think a lot of people will survive.
We'll save a lot of lives.
We will. And then we can go with that banner saying cancer can be beaten.
Yes. Yeah.
You don't
revive
have to
that
die
slogan.
with cancer anymore. And that's all that we need to do.
Yes. And something else you mentioned now is prevention is better than cure, which is also what I'll touch on.
And then the early stages, obviously, if you... So tell us, give us some knowledge, give us some insight, tell us what you know.
There I was in 2010, World Cup in South Africa. Yes. We were the hottest nation. We were it.
Yeah.
Okay. I partied, guys, right? In 2010, I partied because... It's like the president declared, this is the party nation.
Of course.
All the countries were here. Ons het net mal aangegaan. And so, you know, in the aftermath of the World Cup, we still had that buzz for months.
Yeah.
That same year in October, at my workplace, we had an awareness campaign for cancer, like every other year. And there I was Googling, you know, and reading about it. And my sister-in-law Nadine and I go to a women's conference. Actually, it was like an Indaba at Northgate Dome. We get there and they do breast cancer screenings. Okay. Wow. So, and I'll explain what the difference is around screening versus a mammogram versus a check, a self-check. Right, so they've got this bus there inside the building, and inside the bus, you get checked by a nurse. And Nadine says to me, go check. Why does she say that? Because for a year now, I've been telling her about my teeny tiny boobs that have been paining. Okay. But they don't always pain.
Yeah.
And they pain at night. And then I said to her, I'm already, you know, befriending these little nodules that I feel in my boobs. We're already friends. Wow. And the very next thing she says, let's go check out those lumps. We let the nurse check it out. And Soma says, I have to refer you. Like,
I mean, you didn't go there for that. Dude, like, hello.
We're in the middle of a party.
I mean...
Ons like fancy, ons koop goede, ons geniet ons self. She says, I'm giving you a referral to go see a doctor.
Wow.
Now imagine, it's a nurse and she used her hands. She didn't use any equipment.
So that alone was
right. So I'm like, this chick must know what she's talking about, because she didn't even know that for a year long I've been befriending these lumps. So I take a little slip and I go back to work, and workaholic that I was, I'm like, I don't have time for this. Thank goodness across the road from me there's a medical clinic. Okay. So I call the number she's given me and I say to this guy, I'm right here across the road from you whenever you're ready. And he's like, you can come over.
Wow.
Again, I schedule him in between meetings and I go and I get checked out. And I walk in and he's an oncologist. And later in my journey, I learned that he was not really the person that I should be seeing. Maar kom ek sê julle geheim, daai dag was niks lams.
Okay.
Because is it so? As jy by die dokter kom
en dan jy sommer gesond.
There's no lumps. I'm like, dude, I promise you. Like,
yeah.
I didn't
you know them, they there.
Nee, ek dink dis hoekom gaan ek dokter toe as ek nie siek is nie.
Ja,
want dan hulle daar. As ek daar kom en dan niks.
Yeah, you understand. So, he doesn't see anything, but what he does, because he's an oncologist, he sends me for a scan. Which is where I should have started.
Okay.
But by someone scanning, officially scanning my breast to see what the lumps are. So he sends me to a pathologist. And I get to the little clinic. I love this clinic because we were there when we were teenagers. Okay. One of my friends had a lump.
Okay.
And I mean, 20 years later and I walk in there again. Anyway, so I go and... Also, schedule between meetings, guys. Like, that's you the lever, okay?
I mean,
like,
and this thing is now, just ruining your life. Hello, just get it over and done with, so that you can aangaan.
Ek is nog te jonk om vir daai
kanker. So I schedule between meetings. We were busy with big projects at work.
Yeah.
So but it's all in the vicinity of my office. I drive down my own self, park, go up. Guess what this lady does? First, they do a mammogram. So at the time, I have A-cup boobs, like die arme goede word gedruk and because a mammogram is a machine that scans the tissue inside the breast, right? So depending what age you are, the density of your tissue will allow the mammogram to see clearly or not. Young girls have firm boobs, so there's lots of
blocks.
Yeah, there's lots of tissue. And and so
you're 14, I remember.
And then as you grow older, isn't it your boobs become a little bit more saggy, so there's more space, the mammograms are easier.
Okay.
That's when they also find most breast cancers.
Depending on your age.
Right.
Wow.
And so I'm there, I'm in my 30s and doesn't really matter. I've always had small boobs. It was going to be so regardless of my age. And they can't see anything. But then they say, there is a lump. We don't know what. Let's do what they call a long needle biopsy, right?
Die naam alleen maak vir my bang.
Ja.
Die long needle.
En jy wil nog werk. Jy moet nog werk toe gaan.
Ek het net so sekere tyd gescheduled. Sy sê, no problem. Local anesthetic.
In die boob.
In die boob. Met hy nou. She's taking a sample.
Right.
To send off to the labs. Right. I'm like, wow, that was cool. We did 2 procedures in one meeting. You know, that's good.
Yeah.
Thank you for your time. Get out. Hand is lam. Because there was an anesthetic.
Yeah, that's what I was going to say now. And then,
with an arm that's numb. Anyway, I still think nothing of it. I still go about my business and carry on. 26th of October, 2010. I get a call after 2 o'clock. It's this lady. This doctor says to me, we did get your results back and it's cancer. By that time, I must be honest, I had already decided, there must be something.
Yeah.
Just prepare yourself for the worst.
Yeah.
So by the time that they do speak to me about cancer diagnosis, I'm not as shocked as I should
have been, yeah.
There's friends and family around me. One of my cousins came to visit me at the office. So I so much share the news with them. Okay. And just like I am with you guys now, that's how I was at the time. And they're like, are you not shocked? And I'm like, no, plus there's so many medical advancements.
Yeah.
This is going to be a walk in the park.
Okay, wait. So when you got the news that it's cancerous,
yes,
you were not shocked?
No. I think from the time I was in that bus, if you're not aware you're going to put your head in the sand.
Okay.
For a nurse to randomly send me to a doctor, that doesn't just happen.
So you already had your antennas out there to say
my antennas
there is...
out primarily because I don't think she would have wasted my time if it wasn't worrisome.
That's what I like about you. I think with every testimony that you have, that was the mindset you had.
Awareness is very important.
Yeah. So as much as when you got the results, okay, it was confirmation. But you sort of like, I mean, with everything, we'll obviously discover now, with everything that you've gone through, it was like, okay, and then?
Yes. And
it's not going to get me down, so how do I fight this?
And now what? So I say to her, so what do I do?
Yeah.
I don't think she even expected me to have the next step in mind already. I'm like, so what do we do? I'm sure she wanted me to process it.
Yes, you need to first go and...
step?
Yeah.
Fortunately for me, here I am on top tier medical aid, right? And she understands this because I had already gone to her. She says, I can recommend you to go see a surgeon, friend of mine, and I'm sure he'll get you in quickly.
Right.
I'm like, good shot, you know, because the faster, the quicker, you know. I must be honest, I think now that I'm talking to you ladies, I must have thought,
get over it, yeah, and carry on with life.
Yes, by the way, last year,
you guys.
No, it didn't work like that, but she did refer me and I got to see this guy quickly. Also now I start to understand that these doctors, these specialists are not readily available. Long list of people, they always have long waiting lists, but I do get to see him quickly. She made an appointment. In between meetings. So his name actually gets scheduled there in between. So that niemand my book for Cross the road. Geloop in my heels. Hier oor die pad. Get there. Meet this doctor. It's November now, guys. Right? Look how quickly it's November. And the very next thing, I sit in his room. He stands there. He says to me, opens my file. What medical aid are you on? He reads. I'm like, He says, right, I have to go on holiday in December. So let's make this quick.
Okay.
I'm going to cut off your boobs.
Huh?
You're going to lose your hair. And you cannot have babies.
So man, that's so straightforward.
What your first visit? They cut you net so chop.
Die man... weet dan nie waar's elders nie. Hy weet nie wat hallo van waar kom ek nie. Hy weet hier wie is ek.
En hy sê so jou boek moet sommer nou afgesny word. Die een en die albei.
November 2010, this guy says to me, your life has ended. Because I wanted a baby. Wow. Those who know me know that what I only wanted in life was a baby.
Yeah.
And he says no. Hy wil my borst afsny, wil my hare so ek is nie weer vrou nie. Wat gaan aan hierso?
Vat dit net so.
Guys, I walked out of that doctor's office and although we scheduled a follow-up, I never went back.
Wow.
I went to my office, I called around, I said, I need a second opinion, can someone help me? There was a lady there at my workplace that had also suffered from breast cancer. Beautiful, beautiful woman. She passed on a year later. But she referred me. Yes. So I went to go see this doctor, a lady doctor in Pretoria, far out, Pretoria North.
Okay.
And I don't click. Because also now I want to click. Type mens is ek. So I don't click, so I walk out and I don't go back. It's a lady doctor. At least now if someone's always touching your boobs. And I walk out and I go and I do some more research. And then I finally get referred to my current guardian angel, Professor Carol Amber.
So if you can say you didn't accept it the very first time you heard that your boobs needs to be cut off, you won't be able to have kids.
Yes.
You didn't accept it in that moment that you heard this is what needs to be done.
Yes.
You didn't... Spiritually, you didn't accept it.
Spiritually, I didn't accept it.
Yeah.
That's nice.
That's what I like about you.
And not even like you don't make a decision.
Yes.
You walk in there
because he wants to go on a holiday and just get this thing over and done with.
And in the meantime, it's a life-threatening decision for my ek moet besluit. Oh, okay, you know.
Ek dink dis wat baie van ons doen. The minute we hear this is what needs to be done. Nou gaan jy in 'n paniek in. Jy spreek sommer die nuus baie gou.
Jy is besig om te sterf.
Almal sê, jy sê nou vir almal, o, ek gaan my boobs moet afvan, ek gaan dit nie. And I think that's when fear hits it.
It does.
And then because you were so firm in your belief that you first need to
get a second opinion.
But you didn't accept.
I heard, but I didn't accept. I didn't internalize that. So Carol Ann Ben is more sought after than the ones that I've seen.
Thank God for Carol Ann.
It's November. She can only see me maybe in January, right? And so although I'm not panicking, I'm also not willing to wait. Because die limbo gaan vir niemand werk. So what happens is between phoning to get an appointment with Carol Ann to understand what my options are and speaking to my family, there's now some time. So I speak to my family and I say to them, guys, I need to come and see you because I'm all the way there in Pretoria. That's where I live. And they're here in Aldo's. And the only thing you don't want to tell your family is bad news over the phone. Want soos ons nou net sê, mense hoor en dan just the worst.
Verkeerde information.
Because I personally was never panicking. And I know and understand people say it's not possible, but I've come through too much to let something so small. And I don't mean any disrespect to cancer, but something so small upend me.
True.
Okay.
So I wanted to just say to my family, listen, look at me, look how strong I am, look me in my eyes. Do I look like someone that's dying? No.
Yeah.
I've got cancer. You know, I wanted them to understand, ons het slegte nuus mans gaan werk op het. So while I'm working through that, I do get an appointment with Carol Ann on a Saturday afternoon at 4:00. Right?
Amazing.
The favor.
So she says, someone cancelled, you can come in. I prepare myself, clean shorts, Anna's 2010, guys, we're still partying, sorry.
And it's Saturday.
It's
Saturday.
A swimmer, as chillers, you know, so... Ons het die World Cup hier gehad. Ons het nooit opgehou daai hele jaar. Philip was daar. Philip. Anyway, so I go to see her. And just like this, with my legs on the couch, because she was sitting with her legs on the couch and coffee in the hand.
Your kind of woman.
My kind of chick. And she says, okay. She reads my results from the pathologist, right? So she got, because with your pathology results, you get it directly.
Right.
And then you can go and give it to whomever. They also send it to the doctor that they refer, but you get your results. Which is good because I already started reading and Googling those big words to understand. Yes. So I'm sitting there and she says to me, so the results came back and these lumps look very small. Okay. And I'm like, yes, it does. They say 1 centimeter from the scan, right? So the scan was the size, but the actual results was the type of cancer from that little tissue sample. So she reads through it and then she says, 37, you're still young. Like, he's my next best job.
That's what I want to hear.
Yeah. Like, you want to hear, like, at 37 when everyone's like, oh, they're not retired. You want to hear someone say you're young. But what she meant was, I'm still young enough to have babies.
Good.
Wow.
I'm still young enough that I have 50 more. Because as a doctor, every one of them, regardless of whether I clicked with them or not, they all had one mission: to save my life.
Yes.
Whether it was brutal with that guy and his prognosis or the
one that irritated you.
They all have one purpose. And how they get there is they want to save your life. Yes. So she says to me, wow, you're still young. Do you still want babies? I'm like, yes, this is the kind of conversation I was hoping someone would have. Yes, I still want babies. Okay. What we should do is set you up with a gynecologist to freeze your eggs.
Okay.
Because I think this, and she speaks me through the treatment plan that she has in mind from my results, knowing that she has worked with this kind of cancer before. Right. That's her plan. Then after that, she starts customizing your plan for you, because now when you do maybe the other person that was also 37 and didn't want to have babies, but I get to go see a gynecologist. Then she sets you up with a psychologist. Then you meet the anesthetist, that guy, lady person.
That just came out. I don't know where that came from.
She lets you meet them all before you even go under any operational, under any knife.
En by daai tyd so dokter number 1 nou al klaar vir jou gestrip het van.
Daai was ek, daai man is in Italy besig om en ek lê daar sonder.
Jy die feeste vlog.
It's 2010. Hello.
Nigga, please. You guys will edit out the internet, right? And so the very next thing, she then sets me up with meeting all these guys. But the most important doctor, yes, the surgeon, which is what she is. She's a breast specialist surgeon, which means she only cuts boobs. She doesn't cut anything else.
Okay.
She refers me to oncologist. In my experience, the oncologist is the most important doctor in cancer
in that area,
because they're the ones administering the full treatment.
Right.
She says to me, once you get back from the doctor, we'll talk. And we had that open conversation.
Nice.
She had an open door policy the whole time. Yes, rooms are full. You have to wait hours.
But then you can understand why.
You know, because she was willing to see me as an individual and as a person with dreams. Klaar daarbij gaan sien die ander dokter. Hy sê vir my, it's going to cost so much. Unfortunately, your medical aid has decided that this kind of procedure is no longer a necessity for your treatment. It's a nice to have.
Oh, wow.
Wow.
And so, guess what? I'm not willing to foot that 30,000 Rand bill out of my pocket. And although he was the most amazing person I've met, male person working with female parts, and he gave me nuggets of gold that morning when I went to go see him, I decided not to freeze my eggs.
Okay.
But he did say one thing. You have an amazing uterus.
Wow. What a compliment.
It is.
Can you believe it?
That's what you want to hear.
Nice when people say to you that.
Yeah.
Especially when it comes from a doctor saying to you, you have a wall that's perfect.
I want people to understand, the younger people now must understand that when you're in your 30s, 40s, don't write yourself off. If you have a dream, 37 guys, he says you have an amazing uterus. What is that? You understand? Don't write yourself off. Give yourself that chance to say, I can still have babies. Don't pressurize yourself. And so we leave his offices, and 3rd of January 2011, first operation. First operation of 5. Yes.
Okay.
Right?
Ek wil net sê, dankie Vader vir julle Henrietta en things. Van net een maak my nervous.
Yeah, just one off.
Just one.
Yeah. I'd never been operated before in my life before that. That's why it was good to meet the person that administers the anesthetic, because I'd never been operated before. God has been graceful and gracious in my life. I had never needed anything. Like alles was net vir my. So with my family then, every time I get any feedback from any doctor, I interpret and then share the information. It lets them understand that it's a big deal, but it's also not a big deal, And I'd like to attribute our foundation in God as what carried us through. Like, especially with what had happened previously in my life. We don't take our lives for granted that we are here. Enigiets kan gebeur, enigiemand kan gevat word. So as I get information, I just... So ons het students van breast cancer at least geword.
Yeah.
Nice.
And 3rd of January 2011, first operation. And then before the second operation, they say, go meet the oncologist and set up a time, because you're going to have your second operation, then chemo. Okay? So, gaan meet to die man, and very well known and also highly recommended. Maar omdat ek connections het, Professor Carol Ann Ben, she was doctor then.
I think it's not connections, it's the favor of God.
I get to see him quickly and walk in, and he says two things. Don't even think about having babies, he says to me. Like, fuck die mense die skrip gekry.
I mean,
hallo, die mense lekker almal dieselfde skrip gekry.
You gaan nooit babies kry nie. Then somebody says to you, do you still want to have kids? You know, there's a possibility for you still to have kids because you got a good uterus.
Yeah.
Then this one comes, he says, don't ever think about it.
Don't even think about it, he says. And he says, this is the chemo plan I've got. I walked out of his office. I never went back.
Yeah, no, of course.
Okay?
Ek wil jou raak hoor.
Yeah.
Dankie.
Net om daai boema te sê.
Didn't go back. Highly recommended of me. Didn't go back. Met another oncologist down the road. So this one's here. This is closer to my office. Convenience. Maar die Here is goed hoor. Sonder dat jy like even dink daar.
Yeah, in that moment you won't. You don't realize that it's God.
I meet this guy. He's got a foreign accent. He's Argentinian.
Okay.
Older, and he's like, you know, this and the other. And I think also because he's a man van min woorde. Hy was net omtrent, this is your treatment. Hy het nie vir my death sentences left, right and center, unsolicited uitgedeel nie. So what he does is he says, but we'll have to do it on, let's say, the 1st of March. So one thing that you'll know about me is I love to party. Every year on my birthday, I go buck wild.
Okay.
So I usually party, but on my birthday, I
definitely
party. So I say, so on chemo, doctor, are we allowed to have champagne? He says, no. I'm like, okay, so then I can't come on the 1st of March for chemo. And I can't. Can you make it later? He says, but do it. I'm like, either you make it later or I don't take chemo, because I'm not going to, my birthday's on the 12th of March. He checks his calendar, 15th of March. I'm like, shut. En hy het dan die champagne wobbelik ook uit my system in. Second operation, have a birthday with still, there's pictures of the plaster still coming out by my dress. 3 days later, I go for my first chemo. 6 months of chemo. Every Friday, without fail. Die hele dag.
So Fridays, you know, yes.
We booked it off.
Yeah, yes.
So family, we don't know how chemo works. Ons kom met brown paper bags. Daar's omtrent 4 van hulle wat my kappa. Ons bring boeke, ons weet mos nog nie. I go, I get the chemo, we wait. Nothing, no nausea. Hulle is almal daar, ons gaan huis toe, hulle maak tee vir my. No, I had no adverse effects to chemo. Like, while other people sat there and vomited immediately or whatever, I had no. But I had my tribe there.
Okay. Yeah, of course. You wake up.
Afgevat by die werk, die kinders het afgevat by die skool.
Isn't that amazing?
A week lang. My mom was literally just, you know, I think they had a bell for me whenever I needed tea, and they looked after me, and that's 6 months of chemo. I had a best friend who didn't have a job at the time, and she covered me. She picked me up from home and she vir 8 uur, want jy sit vir 4, eerste uur sit hulle op, die ander 3 met jy rus, dan kan jy. And went through the 6 months of chemo. So the type of cancer I had, when we found out why these doctors were so anti me having babies, of the 5 types of breast cancer that women or men can get, mine was estrogen receptor positive. It means the estrogen cells in my body was feeding cancer. So they tried to get rid of it, and with all the treatments. And if I had to get pregnant or have my period, which they stopped throughout that time, it would...
Yeah, your estrogen level
would go up, and that would be detrimental. And they said you could die.
And that is why doctor number 1 was like,
So if we can just give our viewers insight. I liked what you said, and to me that was knowledge now. I've learned something new, that the different types of cancer is found in the texture Or what did you say about?
So when they do that sample, right?
Lump.
When the pathologist takes a sample of that lump, that's when, at that point, do they detect what kind of cancer it will be.
Okay.
And of the 5 types, I only know of HER2. That also informs your treatment. 5 different types, 5 different treatment courses.
Okay.
And also 5 different behaviors of the cancer. All right. So at the end, we'll give links to the Breast Health Foundation where you can find all the facts around the cancers. And 5 different treatment kinds means that we might all have breast cancer, but we might not have the same treatment.
Okay.
So people always come to me and say, "Does that and the other," but
it's not.
We don't all have the same.
And
because I always used to think that if they just scan you, they do the scanning and then they say, okay, you have breast cancer,
and that's it.
It's like
we didn't know that there was. So then, are there like aggressive types?
They are aggressive types
and not so aggressive.
I have friends, a beautiful young lady, Valley. She was 17 years at school when she was diagnosed with breast cancer that had to be operated the next day.
Oh, okay.
Because it was so aggressive. And
that's the importance of finding out.
Yes. And I think
detecting it at an early stage.
What we also should do is encourage young women and ladies to go for your cancer.
The reason why we encourage young ladies is because breast cancer normally, so there's the normal, then there's the exception, right? So normally breast cancer is detected in older women.
Right.
Okay. It's because of lifestyle. Yes. It builds up and then
and the years.
Yes.
Okay.
When you're younger, the reason why you should be aware is if breast cancer is in your family.
Okay.
It's hereditary. It means you were born with it. Whereas the others pick it up, like myself, along the way with our lifestyle, whatever. Some of us have estrogen treatments. We take patches or, and then it exacerbates something in your body. But some are born with it.
Yeah.
So that's the reason why I said earlier with you is now in your ovaries there was cancer. You must find out, would it ever affect the babies that were also around your uterus so that they were not affected? Is it a hereditary? Or mention it at least when they go to a doctor maybe one day and she's just got a flu and she says, yes, my mom had ovary. He can then see if it has any impact. Knowledge is power. And that's when young ladies go and get tested. The other thing you mentioned is getting tested annually. And why they test young ladies with a precondition, they call it, is because the earlier they can detect it. So it doesn't show itself. They call cancer the silent killer. Yes, it doesn't show itself.
And that's what I'm saying. Because a lot of us won't realize or know. Because
it's there.
Like you said, you were dumb. You didn't know nothing about, die pyn is my en is my chommies. Soos ek altyd sê oor die kopseer. Ek kry gereeld kopseer. So it's my friend.
It's now also acquainted with it.
Ons communicate.
If it's not there, it's like, where are you?
Yeah, and dis hoekom sê ek
and then you don't know in the interim something's happening because
but that's God like warning signals, wisdom, right? Yes.
He gave women intuition. Yeah. Women know when something's wrong. Lang voor 'n dokter kom en jou sê, weet jy,
they just confirm it.
Yeah, absolutely. So that's the knowledge is power we're talking about. Be aware. Be aware of your history and also be aware of your body.
Yeah.
Your lifestyle. You understand, if I'm going to be overweight all the time and if I'm not going to do exercises, those are facts that are detrimental to my health. It might not be cancer, it could be something else. But I'm putting myself on somewhere on the list to get something. And so that awareness must be there. The only thing you will never charge me with is ignorance. Because I'll be ignorant and then I'll know, and once I know, then it work. You know.
Then you know.
I have to make decisions based on what I know.
What you know, your knowledge. True.
And then can you go through the programs that you had to go through, like your chemo? What type of chemo did you get? The 5 different operations was
So the first operation is what they call a sentinel node biopsy. So there was that one. There was that one that the pathologist did, which was just a long needle for a sample, right? But the sentinel node biopsy on the 3rd of January. I mean, I can never forget. Daai arme doctor. Thank God she loves me so much. She went in under my arm. Under our arms, we have what God put there, sentinel nodes, right? The sentinel nodes are there to look out for damage in our bodies.
Okay.
And if there's damage, then they will go and collect it to see what is it.
Wow.
So when she goes in to look at my sentinel node to see if there's anything there, it's to see if cancer was spreading. Okay, so we now know because of our scans that it's in the breast, but the node will tell you if it went anywhere else in the body. So the nodes didn't say anything, so she's like, at least it's still localized. Yeah. That tells the doctor immediately what kind of treatment, how harsh, how quick, how fast. So she did that, and then the second is now to remove the boob, and the 3rd, 4th, and 5th is to reconstruct.
Okay. So
phases.
Before you go to the 3rd one. Ek like vra Louisa. Ek like her. So with the second one, when they removed your breast,
yes,
wasn't there like an option for you? Was the cancer so severe that they had to remove it? Because I heard you said it was still at the young, or it was small, or whatever. But
1 centimeter.
Why did they have to remove your breast if it was
so
small? Because
couldn't they just remove the lung?
Yeah.
Those are perfect questions. So both boobs had lumps in, way back when I was befriending the lumps.
Okay.
But the one wasn't sore in my left, the one in my right was sore. It was painful when I touched it. So I knew both boobs were under duress. So when they did the mammogram, they only concentrated on the left. The left showed them activity that made them worry.
Okay.
When they took the sample out, they found that it was need for worry. But when because you must remember, these are scientists, right? So they can see by the image what kind of lump it is. What they found was this was just fibroids, the sore ones. The cancer, quiet, no pain.
So the fibroids maak geraas en julle is
yes.
Another question that I'll ask you.
Right. So now Dr. Caroline and I are constantly having conversations, remember? She tells me my treatment plan. She says, I would suggest you do a mastectomy. So I was obsessed with my boobs, tiny as they were, because I just fantasized about breastfeeding one day when I have this beautiful baby that I wanted.
Yeah.
So if you were going to remove the ducts out of my boobs, it means I won't be able to breastfeed. Ek dink mos nog, jy het jou objective, doctor, jy wil my lewe red en ek het my objective. Ek wil 'n baby, right? So, it must either align or mekaar half or meet of eats. And so she says, I'd like to do a mastectomy. And I said to her, is it really necessary? Because, A, B, and C. She says, I would suggest, listen, it's still your prerogative. You have the say so, because I can't just go in and remove your breast without your say so. But I would suggest that. I say to a doctor, when we get there on that day, I don't want a mastectomy. But when you get there and you see trouble, you give me a mastectomy.
Right.
The alternative was a lumpectomy. Lumpectomy, take out lumps. Right. Okay. So she's like, we go in there with that. When I came out, she tells me the sample I found was actually 4 centimeters.
Wow.
I mean, the lump I found was actually 4 centimeters, not one. Okay. It was bigger than what we thought.
So did it grow?
It was hiding, No, it was there all the time.
Okay.
It was just hiding. Silent killer for nugs. Okay. Yeah. And also, thank God, she got the permission from me to take everything out. Because her job, sy skryp alles. Elke sel wat dink om het evens. Sy's meticulous, sy's cautious, sy wil seker maak jy moenie weer terugkom nie. Sy's klaar daar, So she took out everything and anything around it. Full mastectomy on my left, which means full breast removal. Lumpectomy on my right, which means they just took out the lumps.
Okay. All right. And number 3 and 4 and 5.
Right. So, in order for me, so also another prerogative that they leave up to the breast cancer survivors is, do you want your boobs back? Okay. Right. Look, I love that you're so puzzled. Some women say, cut off, thank you very much, shapa, alaloop. They never go back. They don't reconstruct. They flat-chested for the rest of their life. They use those fake little things.
Eyebrows, many.
Yeah, many loves, and I claim but silicone.
Yes.
It's an option.
Okay.
A lot of older women do it because they're like, yeah, I'm over.
I'm old, so it doesn't matter.
I'm over breast. Some of them, like myself. Yeah. So I said, no, please, I want my boobs back. So the first operation is they put a little plastic holder, like a little ball in my boob as a placeholder. I have to heal fully before they can do other operations. But during chemo, I'm not allowed to be cut.
Okay.
So they put something there that helps.
Okay.
And then during that time, they take that thing out. The skin is grown a little bit back, you know. So then they put something else in and back. And then the last operation, prosthesis in. In other words, you've now seen now you also go see what's the surgeons that, plastic surgeon. That's the last consultation you have. Because not everyone goes for it. So I went for that. And that's when he said to me, so what size? And then he brought my breast, and then I could choose what size. Yes. And that was the final operation. And those other two are very painful.
Wow. I was just going to ask you now.
It was very painful because the skin must stretch.
Yeah, carrying that.
Yeah. So I was also obsessed with exercise at the time. So then I go back to the gym, and then just when I'm like fully in the gym, I'm terug. And
recover, and then patience,
It's patience. Like you remember how arrogant I was on that first day, and I said, let me go see this doctor. I'm so glad I got a quick appointment. Maybe we can do it. Nee, 2 jaar later, toe's ons klaar.
Wow.
Toe word ek gedeclare in remission, cancer free, go about your business, you're good to go. 2 jaar. Also something that we need to understand is it's a process.
It's a process.
Yes.
True.
Right.
True.
And even for the healing.
Yes.
After the cancer is gone, it's still a process.
Yes.
Anything that affected you spiritually, physically, it's a constant healing process. It's not something that because the 2 years is finished, all the operation is finished.
Yes.
It ends there. I'm fine. I'm okay. There's still continuous healing that needs to take place because there's certain things that happens. Your body changes. You know, you need to accept the fact that you don't. I
only drank tea. I was a tea connoisseur before breast cancer. Tea connoisseur.
Yeah.
Right? So during chemo, my taste buds, which is a side effect, didn't want tea close to me.
Yeah.
Now I'm a coffee.
Nou is dit nou so snoepie koffie. Cheers.
Kan jy glo? So the side effects of chemo is also vast.
Of course,
and
depending
there's
on
some
the person.
that's consistent with everyone, and some, like I said, I had no nausea like everyone else. Ek het nooit opgegooi nie. Ek was al pregnant en alles. Ek het nog nooit opgegooi. Ek sê die tipe nie. So cancer didn't even make me nauseous, but some people suffer from nausea. Your taste buds gone. You only taste metal. You can't really use toothpaste, so we use bicarb to brush our teeth. Your skin becomes very sensitive. And dry. And so special products is used.
Skincare.
And then of course the hair that falls out. So there I am, like 6-inch heels, and I'm just, the day my hair fell out, I sobbed. It's like they only told me on that day I had cancer.
All right.
The day my hair fell out, I went to West Park Cemetery.
So did your hair fall out in stages? or did it fall out?
Just suddenly, like...
So they
Or
said...
did you notice that its patches falling out?
They said, and also you must remember there's a lot of written resources about this, but it's generic.
Okay.
So you must also always keep an open mind. They said after the second, third chemo treatment, my hair will fall out. The first one, Soma, I brushed and it was there. And I somehow lost it.
Dude. Of course.
Ek like my haar. Ek like alles van my dit.
Yeah, you don't know.
But you know,
have your hair until you lose
when a
it.
woman's hair is on flick.
So do you think that was the tipping? Can I call it the tipping point? Listening to you, you were so brave. All the time. And it's like I don't even think like day one.
Did you have cancer really?
Do you know what I'm saying?
Yeah.
So
and if you had a breaking point, like
so that was it.
So that was yours.
That was it.
And that's when the
it's
emotions,
like almost the vein point of it,
right?
Right. But also, like you say, so women are known for the fact that we can bring babies. This is what differentiates us from a man. We can bring babies into the world. We have breasts that produce milk.
Yeah.
Males also have breasts. That's why they can have breast cancer, but they don't produce milk.
Yeah.
And our hair is usually long. It's not a stereotype. It's just a general point.
Yes.
So nou vat iemand jou baarmoeder, jou
breast
en jou hare.
Like that's the three main.
En nou kom kry jy's nog hare reg op nee.
So ek wat? So I lost hair here, every single hair on my body. So what my family did, that very supportive cocoon around me, when we saw my hair fall, we shaved it.
We all went. I remember your mom, and your mom was just like
shaved it.
Nice.
And when I saw that, I was like, "You."
Okay, so ek het baie vra om te vra. Ek het gesê dit. So many linkerkant het jou regterkant.
Linkerkant is
die regterkant het mos die
lumpectomy.
Ja, die cysts gehad.
Yes, so they took that out.
So ek het nooit geweet dat jy kan wat roep hulle dit? Wat is die cysts nou weer? Fibroids in jou breast kry nie. Ek het altyd gedink is
it's just that area.
And your ovaries, like it's that's why I say ek leer so baie vandag because I never knew you can get them in your breast.
So always when people are asking, so right, everyone that's ever heard my story and their families, when one of them get a lump in their boobs, I always ask, is it sore?
Okay.
Because the sore was the fibroids. Don't worry.
Yeah.
It's the not sore that you have to worry about.
But I don't think you also... Ek sal maar nog nie sê ons moet sê don't worry about it because
the concern
still get it sorted.
Make sure that
still get it sorted.
Go check it out and make sure.
Absolutely.
But from your experience, because you've already,
I want to quickly put their minds at ease.
Yeah.
You know, even if it's really cancer, at least they still go to a doctor.
Yes.
I like putting their minds at ease, especially people that have sore boobs panic the most.
Yeah.
Yes.
The ones with the not sore boobs
will be like, it's not painful, so we shouldn't worry.
Sore boobs is the most panic. And I'm like, more than likely it's not cancer because...
And you in a position now to actually tell them and guide them, whereas you didn't have that.
Kijk, as iemand nou vir my daai gevra het, ek sou nie geweet het. Ek sou net gesê dit gaan toets, maar seker whatever.
At least now you can say.
Now, like I said, I never knew you can have fibroids in your breast.
Yes.
Ooh.
That to me was like, okay, it's wow. So, die Here weet, soos jy gesê het, die Here het ons body so gemaak.
God created us.
He made us
wonderfully.
Perfectly. Yeah, just so that we...
Fearfully
You know, and our body speaks to us in all aspects.
It does.
Everything that goes on,
it
speaks to you about it. My next question was concerning family. Ek like hoe jy kan jou familie so uitbeeld. And I want people to know or to understand the importance of family support. So what would you tell our viewers how important and why it is important to have family support?
It's important because my healing journey with cancer was 80% a mental overcoming and 20% the medical profession.
Right.
They can only do what they can do. If I already believe I'm dead, hulle kan maak wat hulle wil. Yeah. So in order to have a good, strong mental state of being, it's good to surround yourself mostly with the people that love you, and usually that's our family. Friends, my friends, I had a phenomenal team around me. I had too many amazing people. But my family rallied around me like I've never seen before. I mean, yes, once in my life, but they were very good with that. They were there. My mom was there to watch me. You know, when you can't move your arm or there's so many plasters, she needed to dab. She bathed me. You know, she dressed me. Someone was cooking. Someone was cleaning. Someone was making sure I was looked after. My nephews were teeny tiny little boys, asking me why am I walking around with a Gucci bag, because during your healing process there's a tube that comes from your breast that drains excess fluids into a little bag that, you know, so they made it fun, they made it informative for little kids to understand what was going through them. My family rallied around me. Like, as ek vandag nog lewe, dan ek sê ek dank die Here vir my familie en my vriende.
Nice. So you would say that family or support. Because sometimes you will find in other families that the family support is not there, but you have some sort of support.
Yes.
So
the non-blood family, which is your friends.
So support is important when you go
support
through
groups.
Yeah.
Also arrogant. I call it arrogant for lack of a better word. I thought ek is die deel van die mense nie. You know, walked into chemo first day, thought ek lyk hier soos die mense nie. Firstly, they were older, they were white at my specific clinic. But then I thought ek lyk hier soos die mense nie. And then 6 months later, I threw a party to leave. That's how close-knit
the little
I became.
community you guys start.
Because the more you see people like you, the more you might have your family there and you might be telling them, but in die aand lê jy alleenig daar en dink, maar niemand gaan regtig deur wat ek gaan,
and won't understand.
They won't. And so that end of the first year, when I was just growing back my hair, because September was my last chemo, that December, the support group, Buddies for Life, they had their year-end party. And I went. They've been inviting me all this time. Wat gaan ek daar gaan doen? Ek ken eers die mense, praat nie hulle taal nie. When I got there, the words they were using, they looked like me. Afhare en dis meer. You know, like, it was amazing. I said to my sister, why didn't you come earlier?
Because now you can relate to your topic, the subject.
You don't.
Your language is yourself.
Yes.
You're not like somebody that understands me. I don't have to explain.
So I want to say to those people that feel, oh, I don't really want to talk to someone, go to the support groups. You don't even have to talk, as long as you can just sit there and see. Want as jy ook iemand kan sien wat deur dat kom wat jy deurgaan, then you already have hope.
Yes.
And you don't even have to socialize. I know some women are going through the cancer journey on their own. Too scared to tell friends and family.
And that's my and that is why I'm asking you all the questions, is for people to know. You don't have
the
to
importance of it.
So you don't have to be on your own.
You don't have to. And even if it's just that one person that you go to, or that you speak to, or that you can open up to, because ek weet om deur iets soos dit te gaan, and you don't know how people would accept you, it's difficult. But then you need to find that one person. That's why support. I think support is a very big
vital
role in any healing, whether it is physically, mentally, emotionally.
If
you have the support there, then. And one thing I can say is, ek ken nie jou familie by naam nie, maar ek wil hulle net thumbs up for you know, showing us
van Kramberg clan.
Yes, you know, the support. We thank you. You. Verstaan jy? And I'm actually happy that you still find families that so supportive.
Yes, it's very imperative.
Yes. Nice.
I know you have a lot more questions. So it's then the after effects of chemo that people have to be aware of. It doesn't come without its negative. It saves your life, but it comes with its negative. I was fortunate. I did not need radiation. So cancer is removing the place where the cancer is. Not always possible in other cancers. I mean, one day at the same clinic where I was getting my chemo treatment, the one lady said to me, "You're so lucky you have breast cancer."
Yeah.
People with pancreatic cancer.
Yeah, you compare the...
You can't take out someone's entire stomach, unlike my boobs. So yes, the silver lining far in the distance.
I completely understand that, because when I look at another amputee, and that amputee has a knee, you are so lucky to have your knee. If it's just the foot that's been amputated, all you need is a prosthetic foot.
Yeah.
Whereas with the knee, there's so much to it, the mechanism you need to be able to replace your knee for it to move, the joint and all that, And so just like you say, so I can relate with the lady who actually said to you, even though in their situation, it's like, I lost a foot. Yeah, but you have your calf, you have your knee, you still... And
it's
that
like
you
that
can
silver lining that you don't want to
see,
but it's there.
Yeah.
Because someone always has
so the
it
comparisons,
worse. Yes. So the treatment is the actual place where the cancer is to be treated. Then there's chemotherapy to flush out of your system. Then some people, depending on... Remember, if you're a good doctor, you customize the treatment plan. Some people start with radiation, right?
Wow.
And what that means, radiation is the treatment where they put this ray of UV directly on the area where there's cancer to either shrink it or remove it. And after that, they'll check if there's still need for operation. But radiation, you can only have once in your entire life.
Really?
Wow.
Like one session or one
treatment, let's say it's 8 weeks, however long, treatment, but you can't have it again.
So once that is done, it's done, and then if it's still there, you need to go for...
When my eerste chemo kry dan radiation.
So if in my case, radiation wasn't necessary.
Okay.
Wow. I was like, save it for another dag as ek gaan nodig.
Or for iemand
because it's only a one time.
So you could get radiation and chemo, or just radiation. Then but there's that cocktail of a treatment plan that's put together for all have side effects. Yeah.
Wow.
Recovery after that, like after it's been 2011, 2012, 2013.
Now because with chemotherapy, one of the side effects I had was I had to learn to walk every morning because you lose feeling in your legs.
Okay.
It's the poison, man.
Yeah.
So walking 2013 for me was bliss because I now didn't take for granted. But some mornings I would still wake up and still be a little bit sensitive. My toenails are black till this day. My arms are, they feel plasticky because there's been a lot of cutting.
Happening.
My breasts, I don't have a nipple on my left hand because they removed everything. So these are still things that I live with. Other of my friends have heart problems. One of the consultations you have to go to during when you're diagnosed, before your operation, is a heart surgeon. We all go and see a heart surgeon.
Is that only for breast cancer, or is it for all types of cancer?
All types, because whenever chemotherapy is involved, why? They want to see if your heart is strong enough to handle chemotherapies. One of my friends still has a heart problem until today. Another of my friends has a pulmonary problem where their lungs were affected by...
Was this during the chemo?
During chemo. So you pick up stuff. But I've been very fortunate. Like swart naald, they give it, no nipple. Those are the effects, side effects, after effects of my war that I carry, my scars. which my daughter calls it a crack. She says, there's a crack. I'm like, yes, there's a crack. A crack you can always fill with gold. And now it's something new, you know. So I take my crack any day to have my life.
Nice.
And then when it comes to the psychological part of it all, the mental part, you went to see a psychologist?
Yes.
And how was those sessions?
In my case, the psychologist came to see me directly after the operation while I'm in hospital. So also for those people that have medical aid or not, it falls under hospital.
Right.
Yes.
Hospital
so they have to.
Wonderful. She loved me. We had our session and she's like, are you sure you don't want to become the president of South Africa? Because my mental state was of such a nature that I was very strong. I knew what I wanted and where I was going.
Yeah.
I was lying in a hospital bed, bandaged up, freaked out after anesthetic because it was just uncool, that feeling. But I still had so much hope.
Yeah.
She was super impressed. I never saw her again. Now
okay, was it just the one session or did you
go? I'm sure other people see them all the time, but now I was such fun. She didn't need to see me again.
She was like, you okay?
You don't go to a psychologist anymore?
No.
Okay.
Nice.
Not then for cancer, no.
Okay. So that was only because hospital prescribed or suggested you should see.
It's part of that. So, I mean, also, I had medical aid. So this is not the norm. It's only if you have medical aid.
Right.
If you are in the public sector, you get none of this nice to have.
I wanted to ask you because I think with medical aid you have a lot of benefits, and non-medical aid members or people that is not covered with medical aid.
They have to go through that system. That
public
government,
sector.
That system. That's.
I think the healing or the process it may be different.
The whole experience, it's a
different.
nightmare. It's a nightmare. I worked with Cancer, the organization. I saw firsthand how they had to give people transport money to get to their chemo. I know of a lady on the cover of this magazine who gives people a bag of goodies with sandwiches when they're sitting there for 8 hours. Who don't have food.
Wow.
It's some people in the public sector get turned away months. You know how it is. Yes. Come back, Bernardo's. Come back. There's not that doctor available.
Go back with the pain and in the situation they were.
They don't get the treatment that. When I say to you, I saw a specialist within.
I mean,
I don't take it for granted, but it was because of my medical aid. It wasn't because. If I was in public sector, I would probably still be waiting for a boob.
I totally agree with you because I see that in the amputee area
as well, right?
Say that nou ben haar vingerrok gesien.
Oh yeah, no.
Sy rehabilitate haar vinger was die
because
the doctors is net daar beskikbaar.
Compared to when I went for when I had the amputation. Because it was private sector and it was medical aid. The support, I mean, your doctors are just completely different to the Paraguana doctors. Yes. Not to mention names or whatever, but there's a complete total. I mean, you know, the way this thing happened was like, even my author said to me, jy het nie so aangegaan oor jou been as wat jy aangaan oor. It was a whole different experience altogether. I think they just make it so much more easier for you. The private sector. I mean, the doctors are there 24/7, especially when you're in ICU. They're constantly there checking up. Are you fine? Mrs. Brown, Mrs. Brown. Paraguana, jy ken sy naam nie.
It was Lani and I don't take it for granted because currently I don't have medical aid. So God knew when to give it to me when I was top tier.
That's what I said.
Right. But I don't take those for granted. Yeah. When I'm telling you now, like the day after I was got my chemo, I was already going with Cancer, with Breast Health Foundation, to areas looking at other people that don't have the benefits. And it's heartbreaking. The stats for breast cancer deaths in South Africa, a big amount of it can be contributed to the fact that people didn't get help in time.
That's one thing I also wanted to mention. I think a lot of our people die because of the lack of our health system, and not because...
Which is being reviewed, but it's taking forever in the meantime.
And I think that must have a personal effect on you, because there's no progress. Like with you, it was... Okay, you got to see doctor number one, but then you had the option of going to somebody else.
If I was in public sector, I wouldn't have the option.
If that was the case, jy sou nou net geluister het na dokter en sê, okay, ja, doen het maar. If that's what we have to do it.
And also what I've learned is people from other provinces come to Johannesburg for medical attention.
Wow.
So we have the best doctors. So as like I can say, oh, ek like die public sector doctor, nie, laat ek somewhere else gaan nie. Cape Town is now also becoming very big with their breast cancer care. Good. They're also forming a big network. They're making it available for people in the public sector to get the best medical attention. But my doctor, Professor Carol Ann Ben, has a whole unit at Helen Joseph. It's called the Pink Clinic because it's right there. She gives everyone that walks in there the same treatment I got. And it's public. So there are a few doctors in South Africa that's trying to, but it's too much. We do what we can with what we have.
What you have. Yes. That's amazing. That's amazing. Anything else on your mind that you would just like to...
The cancer.
You know, you want people to hear, you want people to...
But I would, like we said, our program is to encourage, to motivate, and inform, to make aware of certain things. So what is it that you would want to inform people about?
I would, especially in locations, like informal settlements, all these, not the metros, like ons wat met mekaar bly.
Urban areas.
We must talk about it. Like find out in your family, who was ever, die oma wat gesterf het, die auntie wat... Is cancer in my family? Because if it's not, then I'm carrying on, but become aware.
Self-awareness.
You know how we're always looking for our history amongst our people? Ask the medical questions as well. So that we predispose ourselves to a better life by making better choices with the information we have. Do not take it for granted when amal is hush-hush. Even with HIV, ask what happened. Like, let's talk about it. The more we talk about it, the more nothing is taboo.
True.
Right now, I wanted to mention that even with corona, there's still cancer patients, and they still need assistance, and they still need help.
It's just the focus is now
the focus is, but there's still that. And so there's still your avenues. The support groups are online, but it's still there.
It's still there.
Yes, so don't for a minute think, I'm sitting in my little corner, it's just me. Praat, vra jou familie, praat met the neighbors, soos ons gesê het, praat met the chommy, speak up and get help as quick as possible, only to save your life. I used to walk around, especially at corporates, to say that I'm here today to talk about breast cancer, surviving breast cancer, but my actual goal is to save someone now that we want you to see your grandchildren one day.
Wow.
Yeah.
And that's the aim.
Wow.
Nice. Is there any centers or what activities or awareness campaigns is happening? Aangezien het nou die 4de is, it was no
World Cancer Day. So a lot has toned down with corona, but I know at Tradewood Mall, there's a group of cancer survivors that are very active, and I'm sure they'll definitely be cutting and coloring hair. They love our long hair to donate it to women for wigs. Money donations always helps with cancer research. And then Carol Ann, Ben, the Breast Health Foundation, they have like bus-like units that go around in areas that are not close to hospitals with nurses to do the screening that we were talking about. Nurses do a clinical screening. We at home do a breast check for ourselves, and then there's mammograms. These are all things that we must do on the regular. And then the Breast Health Foundation has an online support group at the moment. No one's meeting physically anymore, and if they do, it's just a few.
Okay.
But I'll post everything on your social media so that people can have access to it. Even if a family member is the one going through cancer, you can still go to these sessions
and get the
information and bring it back. Maybe they're too scared to.
Yeah. And then if people want to reach out to you, are you available?
Media, to Henrietta van Kramberg, everywhere. Instagram, Facebook, Twitter, definitely. Please contact me. I used to tell my family, I would love to hold your hand when you go for that examination that you're so scared of. I would love to hold your hand. I'm sure my energy would go through.
Of course.
Because if you're afraid to do it, I would go with you. People can phone me and I will go with you.
You'll be the
contact me
hand.
on social media. Let's hook up. If you don't want to go alone, I'll go with you for that.
Awesome.
First.
Awesome. And then any encouragement for the survivors, and just to motivate them not to give up. When you get your results saying that you are negative, what can you tell them to hold on and to just stay positive,
So the one thing I need, like whoever's listening to this, you guys know, there's nothing extraordinary about me. There's nothing special about me.
What?
If I can do it, anyone can kick cancer's butt. I did it in 6-inch heels. Wow.
There we go.
Anyone can do it.
The 6-inch heels.
Yes.
I love that phrase. I love